Welcome to my YouTube channel. I'm Dr. Ahmed Al-Baghdadi. I'm here to talk about the sternal angle, clinical significance and anomalies. The sternal angle, also known as the angle of Louis, is the angulation at the joint between the manubrium and the body of the sternum. This transverse joint is called the manubriosternal joint and is a secondary cartilaginous joint of a type known as a symphysis. The angle varies between 160 and 169 degrees. The sternal angle is an important clinical landmark for identifying many other anatomical points. It marks the point at which the costal cartilages of the second rib articulate with the sternum. This is particularly useful when counting ribs to identify landmarks, as rib 1 is often impalpable. The counting of ribs is essential when one is attempting to make a thoracic incision. If the wrong rib is counted, access to the internal chest organs can be difficult. Additionally, making an incision at the first or second rib interspace can result in damage to large, important blood vessels and the brachial plexus. Identification of the second rib and thus the second intercostal space inferiorly is also useful when auscultating heart sounds. The optimal location for auscultation of the aortic valve is generally the right second intercostal space, whereas the optimal location for auscultation of the pulmonic valve is generally the left second intercostal space. It is at the level of the T4, T5 intervertebral disc. It marks the level of the transverse thoracic plane, which divides the mediastinum into the superior and inferior mediastinum. It overlies the aortic arch on the left and the superior vena cava on the right. The pericardium extends from just superior to the angle of Louis to the level of the xiphisternal joint. It is roughly at the level of the bifurcation of the trachea. The tracheal carina is deep to the sternal angle. It is roughly at the level of the bifurcation of the pulmonary trunk. Ligamentum arteriosum attaches to the aortic arch deep to the angle of Louis. Many different sternal anomalies can occur following abnormal development. A complete sternal cleft can occur when the two sagittal bars of the sternum do not fuse. An incomplete fusion can cause a sternal foramen to be left within the sternum. The sternum can protrude in pectus carinatum, known as pigeon breast. The sternum can also recede in pectus excavatum, known as funnel chest. These variations are due to both abnormal angles of the sternal angle and to curvatures of the sternal body. These abnormalities often become more pronounced during childhood. Surgical considerations. The manubrium and proximal sternum are routinely opened up during open heart surgery. A mechanical saw is required to access the chest cavity. In children, strong sutures can be used to put the sternum back together. But in all individuals above age 2, stainless steel wires are required to realign and close it. Thank you for listening. See you soon in another topic.